Today we will perform general physical examination, and before performing general physical examination you have to keep in mind two essential things. Number one, that your patient must be very comfortable. Room should not be very cold or hot, and you should keep communicating with him so that he is more acclimatized with the environment. Number two, from a distance you can gather any information like any obvious dysmorphism if patient has. You need to have a look at the color of patient, whether he is pink in room air or is there any cyanosis. Look for breathing, is he breathing comfortably or is there any tachypnea or dyspnea. If for example patient has just stepped in the room and he is walking to you, do not lose this opportunity to see whether he is walking normally and there is no limp or any asymmetry of any body part. Hello Faizan, how are you? Are you okay? Comfortable? Okay. We need to go in order. The first order should be to check for vital signs, or vice versa. We can start with the hand examination and then we can proceed accordingly. I need to take breathing rate at least for half a minute. It's 26 times per minute. Next I will go for pulse examination to see whether there is any tachycardia or not. For this I am keeping his hand and arm in a semi-prone and semi-flexed position. Palpate the radial pulse. It is 96 times per minute according to my calculation. For checking the temperature, we need to make sure that we have dropped down the temperature at least around 94 or below. So I will put thermometer in axilla and put my hand on the right arm so that it does not get displaced. You have to keep there for 2 minutes and then see what is body temperature, which is normal. It's 98 degree Fahrenheit. I will check blood pressure. The cuff shall be applied at least an inch above the cubital fossa. Blood pressure is 100/70 millimeter of mercury, which is absolutely normal. With the hand examination, we need to have a look for any clubbing. The better way would be to make a diamond angle of both index finger, which can give us a clue whether there is a clubbing or not. Faizan, you need to put your fingers like this. If there is a space visible between the two fingers, then there is no obliteration of the angle between nail and nail bed. You can clearly see here that angle has been obliterated. You can look at my fingers and you can clearly see a visible diamond-like space in between, which indicates that there is no clubbing. Faizan has grade 1 clubbing. Next thing is looking at any joint swelling. Palmar erythema, pea-sized nodules which are Osler's node can be seen, or sometimes Janeway lesions which are indicative of rheumatic fever or subacute bacterial endocarditis. Next thing in younger children would be to look for wide wrist, which is an indication of rickets. I am generally looking at the nutritional status. He weighs around 19 kilo at the age of 7.5 years, which seems little lesser, maybe at 5th percentile or so. Just looking at the skin, which is normal. There are no hyperpigmentation, stria or scar marks anywhere, but BCG scar is visible on the right deltoid. Next we will go to the head end, looking at any low hairline or any other dysmorphism. Head is symmetrical in shape, hair are normally in texture and color, they are not easily pluckable. Eyebrows are normal in shape, there is no hyper or hypotelorism. His eyes, cornea and sclera are quite moist, which is indication of good hydration. Faizan, you have to look down on my head. Look for jaundice in sclera, dryness of sclera or cornea, xerosis cornea or conjunctiva, pitote spots. You can clearly see on the lateral and upper part of the sclera, it's normal in color. There are no pitote spots or any other telangiectasia or indication of any other disease. Now we will ask him to look upward for pallor. Upar dekhe, he is not pale. Look at the nose, he is breathing comfortably through the nose, mouth is closed, so both the nares are patent. Look for 4 things in the oral cavity: hydration status. Number 2, any oral candidiasis. So he is well hydrated, there is no oral candidiasis, oral hygiene is good. Looking at palate and oral mucosa for any rash or evidence of bleed, which is none. If you are looking at the oral cavity and patient is coughing, do not lose this opportunity to have a look at the throat and tonsils at the same time. So next thing is examination for thyroid and lymph node examination. For lymph node examination, we will take a separate session. We will go for pedal edema. You have to put your right thumb an inch above the medial malleolus. Keep looking at the patient's face so that he does not get hurt. Keep pressed for 30 seconds. So if there is any dip, that is indicative of pedal edema. The last thing would be to have a look at the genitalia to a certain gender and whether the genitalia are normal or not. The final thing would be to look for thyroid. Just sit down, Faizan. Any swelling which moves on deglutition is thyroid. Thuk niglo gale mein. So here it's minimally visible, moving on deglutition. It's grade 1 thyroid, which is many a times normal. In case you find a larger thyroid or goiter, palpate for isthmus, for lateral lobes. Palpate it clearly, ascertain its consistency. If there is a nodular goiter or it's firm to hard, ascertain that it's not attached to carotids. But this is a rare situation, as thyroid carcinoma is almost non-existing or very rare situation in pediatric age group. So it's not an essential component. Thank you very much. Now I will help him to dress up again, and if you have any queries or questions, you can ask.